November is Diabetes Month, and here with us to talk about this global concern is Kristen Balanowski from Niagara Health. Kristen, diabetes, is it more prevalent today than it was maybe 20, 30 years ago?
Yeah, absolutely. I don't have specific numbers for you, but off the top of my head, but diabetes, it's definitely prevalent and it's growing as well. Definitely more people being diagnosed now more than ever.
So off the top, I said it's a growing concern across the globe. Are there hotspots for diabetes? Is it more prevalent in certain pockets of the world?
Yeah, good question. I wouldn't know specific locations, but we do know that Indigenous populations tend to have higher rates of diabetes, which is definitely something that we have to work on and work towards to kind of getting that health equity for all populations.
We look at really two different types of diabetes, type 1, type 2. Can you explain the differences?
Yeah, so those are the kind of two main types of diabetes. Type 1 diabetes, it's an autoimmune disease, meaning our body tends to attack our pancreas, and our pancreas is what produces insulin. So once those insulin cells are all gone, the body's no longer producing insulin. So for type 1 diabetics, they have to inject insulin. That's the only treatment option for them. Versus type 2 diabetes, what can happen is they can develop something called insulin resistance. So what that means is their body is producing insulin. Sometimes the insulin they're producing isn't as good anymore, or the body just doesn't respond to the insulin that it's producing as well. So there's different treatment options for them, like pills or insulin, just depending on the person and what treatments might suit them best.
I always remember that, I grew up with a grandmother on my mom's side who had diabetes, an uncle on my father's side, so my father's brother had diabetes. So I was always concerned it might be hereditary. Is the type 1 the type that is usually hereditary?
So it's actually type 2 that tends to be more hereditary. Some people with type 1 might not have anyone in their family with type 1 diabetes. So type 2 is actually the one that tends to be most hereditary. But there's many different factors that can go into what might prompt someone to get diabetes, different environmental factors, hereditary, many different things.
Diet?
Yeah, absolutely. Diet has an impact. Same thing with activity levels. So just maintaining a healthy, balanced diet and activity levels will help prevent or delay diabetes. But also keep in mind that some people have very well-balanced diets already and they exercise frequently and still sometimes can develop diabetes, which is a shock to most people.
If you're going for an annual checkup, what does the doctor look for as a sign of diabetes?
As far as what the doctor might typically look at is there's a piece of blood work called a hemoglobin A1C. That A1C, it's like a 3-month average of your blood sugars, so they can look back and see kind of roughly where your blood sugars are. And then based on that number, you might get diagnosed with diabetes, there's pre-diabetes, or just kind of assess to see your risk there.
And myself, if I'm feeling tired, is that a sign? What are the signs?
The signs, yeah, so signs for diabetes. So feeling tired, that's definitely a sign of diabetes. Other things like feeling thirsty, frequent urination, sometimes even weight loss, unexpected weight loss can be a sign for diabetes and high blood sugars.
I know that Niagara Health has 3 diabetes centers across the region. Where are they and what actually happens in those centers?
Yes, so there's 3 with Niagara Health. There's one at the St. Catharines Hospital, one at the Niagara Falls Hospital, and then one at the Welland Hospital. So at those clinics, typically we'll have appointments one-to-one with the patient, and then that's with a nurse and a registered dietitian. So we kind of work as a group to just kind of go through the person's diabetes, go through their management, provide education on diabetes. That's our biggest role at these clinics, and just kind of see what the patient specifically themselves needs.
Managing the disease is something that becomes an important part of their lives. What are some of the tips that you usually offer these people?
Yeah, so it really depends from person to person, but when it comes to management, we might look at the medications that they're on, see what medications would suit them best. We might look at if they're on insulin. Sometimes we'll look at adjusting insulin doses to get their blood sugars under the best control. We might look at their exercise, their activity levels, because that can have an impact. And then the dietitian, they go into detail about food history, what they're eating, and how they can adjust their diet to best suit their diabetes.
Technology has changed. So again, if I go back to my relatives who suffer from diabetes many years ago, they were always daily giving themselves an injection. Is that still the case, or are there options?
Yeah, so insulin it's still available. It's always going to be available, I'm sure, because insulin is known to work for diabetes, but there are many more options available now than there were before. So there's different pills that you can take for diabetes, for type 2 diabetes, I should specify, because insulin is still the only option for type 1 diabetes. But for type 2, there's different pills that you can take. There's also different injections that aren't insulin. I'm sure you've probably heard of Ozempic. That's one of the examples of a diabetes medication that can help as well too. But lots of different options that typically we can try before starting on insulin. But again, that's different from person to person. Some people, they need to be started on insulin right away, but again, we just take it case by case.
We live a lot longer these days as well. Is that helping to increase the rate of people who have diabetes in Canada?
Yeah, absolutely. So we know that as people age, sometimes the rates of diabetes kind of go up with age. So because we're living a lot longer, we tend to see these kind of comorbidities pop up. So diabetes, that's just one of them that might come with age and as we live longer.
Where can people find more information about all of this?
A great resource is Diabetes Canada. You can search them up online. They're very accurate with their information. We get our best practice guidelines from them, so they're a great resource to look up for sure.
So for November being Diabetes Month, it's really important to get the word out?
Yes, absolutely. It's great to get the word out about diabetes and then also get the word out about that there is help for diabetes for anyone who is looking for help managing diabetes. So definitely they can either contact their doctor to get a referral to the diabetes clinic if they want some help managing, or look on Diabetes Canada. Online, they have some great resources.
Kristen, thanks for coming in. A very informative chat.
Thank you very much.